This study from JAMA back in 2002 basically compared and just looked at about 6,000 patients and said, well, what is the correlation with your body mass index? In other words, is it really true that the higher your body mass index, the more chance that you have of having different diseases? And well, that is true. And the way you read this is basically from left to right. If your body mass index was less than 25 in the normal range, this was the percentage of the patients in that study that had things like diabetes, asthma, high blood pressure, and cancer. All the way to the right, the red is where your body mass index is 40 and above, okay? This is the one, if you look at high blood pressure, 51% of the people in that study who had a body mass index of 40 and above had high blood pressure. Diabetes, 1 out of every 4, 26%, okay? 26% of people in that study had diabetes at the BMI of 40 and above. This is the one that really strikes us as surgeons, is that the fact that 52%, half of the people who had a body mass index of 40 and above had some type of cancer. Breast, ovarian, endometrial, uterine cancer, rectal, prostate cancer. Your chances for developing cancer are all increased. People think, oh, it's just heart disease, it's high blood pressure, it's diabetes, that increases. No. We've clearly shown that your cancer risks also increase with you being bigger, okay? Well, this is basically a recreation of multiple studies that have all shown the same thing, and this is just a graph showing as your body mass index goes up, especially at a BMI of 30, which is obesity, remember, 30 to 35, you have a linear relationship as far as your chances of dying from something related to your obesity. When you hit a BMI of 35, remember that was the number I told you about from the National Institute of Health in 1991, you start to see that there's an exponential rise in your chances of dying from something related to your obesity. If I were to try and continue this line above where your BMI is 40 and above, that's clearly why BMI of 40 is a determinant of your benefit from surgery, because at a BMI of 40 and above, your chances of dying from something related to obesity is very high, okay? This study I like to show because people are always like, well, gosh, you know, bariatric surgery is really dangerous. You know, that's pretty radical. I think it's really, yes, it's very, very helpful for people, but it's a little scary because it's really dangerous. Well, this study really compared several thousand patients, about 4,000 patients in this study, that compared people who had surgery in a 5-year period and compared age-controlled matched people in that same 5-year period who didn't have surgery. And just simply said, well, what happened to those people? And was there any difference in the mortality, their chances of dying in those 5 years? And people who actually had surgery had a 9 times lower chance of dying during those 5 years than if you decided to stay at your obese state with all the medical problems that go along with it in those 5 years. So this showed basically that at that time, in this study, 2004, this is 6 years old, we've got several studies that show the mortality rate in the first 30 days after surgery, which is what we look at that time was 0.68%. Really, our mortality rate nowadays is even less than 0.3, even 0.1%, as far as your chances of dying from the surgery. We've not only standardized how to do the surgery, but also what to look for postoperatively if there's an issue, that we go and aggressively treat it right away.